This podcast is brought to you by Meteorate.
Hello and welcome everybody to the Seriously Funny Wellbeing Show with yours truly, Homer Papantonio. And with me is someone who doesn't need an introduction, but I'll give him one anyway, Dr. Ross Walker. How are you, Ross?
I'm fine, thank you. Lovely to be here.
It's great. This week's podcast is on the draining and tiresome subject of fatigue. So I thought we'd kick off this podcast with some humour related to fatigue. So here goes. Ross, why did the keyboard get exhausted after work?
No idea.
Because it had 2 shifts.
Right.
We laughed. Yeah, that's beauty. And Ross, I had to quit working at the gym because I got too exhausted racking all the weights. So I put in my 2-week notice.
Oh, gee. Yep.
So
yeah, I think 2 week is probably a good summary of that joke.
Okay, medical news is on experimental cancer vaccines.
Yep. Yeah, and this is a big deal. You see, and I don't want to bring in the arguments from the anti-vaxxers, these vaccines are dreadful things, et cetera, but this is using the same technology as the RNA vaccines for COVID. Now, let me explain to you why there was an issue with the RNA vaccines for COVID. Because basically, the mRNA vaccine is a direct copy of the DNA of the spike protein, and then it's injected into people. Now, the spike protein of COVID initially was very pro-inflammatory. So therefore, people who were given the RNA vaccines, Pfizer or Moderna, for COVID, some of them did have an inflammatory reaction to the vaccine. But what people have to realize is with the initial, to quote the Donald, the China virus, the initial Wuhan strain was very lethal, 3% mortality rate, probably 30% of people had significant reaction to the initial COVID virus, not vaccine, had long COVID as a consequence. So when you then took an RNA copy of that spike protein, the way the COVID virus got into cells, it was very pro-inflammatory, which is why some people did develop myocarditis and pericarditis and what they're calling the vaccine injuries. But they've used the RNA technology, getting RNA copies of different cancers. So basically what they've done is taken your own cancer and developed a vaccine against that, which allows your immune system to recognize that cancer so much better. Because one of the things cancers do, a lot of people don't realize this, they trick the immune system. They almost have an invisible shield around themselves.
Yeah.
And in fact, the invisible man married the invisible woman. I actually don't know what they saw in each other. And their kids weren't much to look at either. But anyhow, that aside, so the cancers trick the immune system by having this invisible shield. And so what these vaccines are doing are breaking down that invisible shield and making the cancers more visible to the immune system. So they're using that sort of technology. So this study was done in about 19 people who had very advanced end-stage cancers where they had nothing else left. So basically they were dying. And when they looked at about half these people who were given the vaccine, so this is people who were definitely going to die, half of them still months later had no further tumour growth and no new tumours. So this is very, very promising early stuff, and I think pretty exciting for the near future.
So what's the preferred option for cancer, having a vaccine or a cure?
Well, I don't think there is such a thing as a cure. I mean, for example, the best option for cancer is to detect it early. And in fact, we're now getting to the point where the technology's there. It just needs to be validated and accepted by the medical profession, where you have a blood test that picks up early tumour markers of cancer, so what we call circulating tumour antibodies. So every cancer has its own DNA footprint. And so these blood tests can pick up that early DNA footprint so that if you've got a cancer brewing somewhere, and it takes one cancer cell 9 years to become a 2-centimetre tumour. So when it's in its early stages where it might be a really tiny tumour, that you can't even see on scans.
Yeah.
You might be able to detect it in the bloodstream. Once you can do that, you can see, that's the marker of a lung cancer, or the marker of a breast cancer, or the marker of a kidney cancer, and hone in on that organ to try and find out where the cancers are, and then remove the thing early. So that's the only way to cure cancer, is to detect it early and get rid of it with either surgery or targeted therapies at that cancer. So, once you've got to this point where you've got end-stage cancer that's spread all through your body, there's not much left.
Yeah.
So now we're getting to the point where there may be something in the relatively near future that could potentially either arrest or possibly even, as you said, cure cancer.
So the vaccine is the preferred option.
Well, it may be, but there are there is immunotherapies. There's a whole lot of new therapies coming through. So
Okay.
I think, like anything in medicine, there is not one treatment. There's integrative treatments that work to get rid of that particular problem.
Okay. So future of medicine, Ross, wearable lung patches.
Yeah, this is interesting because it brings up the whole concept of monitoring people. And we speak a lot about being able to monitor your heart with the Apple Watch or the other smart watches that can do ECGs and all that sort of stuff. And everybody knows about having home blood pressure monitoring. We now have the continuous glucose monitor that you can actually put onto your skin, leave it there for 2 weeks, put your phone up to it, and it gives you a blood sugar level. So all of these things are happening, but people don't talk a lot about monitoring lung function. And the problem is when you've got asthma or chronic lung disease, that many people with these conditions will work their life around it, so they'll avoid activities where they get very short of breath, and often their lung function is not being monitored and managed properly. So this particular study looked at 52 people who were part of an asthma outpatients clinic, and they put this little patch on their lungs and got them to breathe for about 30 seconds deeply, and it found that it could work as well as an automated stethoscope to see whether there was any wheeze. Because a lot of these people will just sound okay when they're talking, and they'll be able to do normal, mild activity, but they really are struggling with their lung function. So it'd be very good to be able to have a wearable that tells people what's happening in their lungs. At the moment, if someone is a chronic asthmatic or has chronic lung disease from their prior cigarette smoking habit, because hopefully no one these days is smoking or vaping, which is just as bad. But what they can do is have a peak flow meter where they blow into this little tube that tells them how good their lung function is at the moment. But this is probably even easier, just to wear this patch, breathe in and look at your phone and say, I'm wheezing today, I need more therapy, I need to really hone my asthma management plan, or possibly need to get back to my specials and have my lungs sorted out.
Yeah. And you can't have healthy lungs and smoke at the same time.
Oh, no. Can I say to you, for anyone listening to this, any asthmatic who smokes has a 100% chance of developing emphysema. 100%.
Wow.
So look, I think everyone should stop smoking. I personally, come the revolution, I'm running the show, it'll be banned.
But it's financially debilitating. My wife was at the Coles the other day, and this lady in front of her had a carton of cigarettes.
Yep.
How much do you think the carton of cigarettes was? $502.
Oh, yeah. But look, can I say, smokers are doing their bit for the community. Let me tell you why. The government gets around $5 billion from the tax. No, hang on. Let me finish.
Yeah.
It's $5 billion from the tax excise from cigarettes, but pays out $10 billion in the diseases created by cigarettes. So they're down $5 billion, but here's where they save their money. Smokers are very community-minded people because they die 10 or 15 years earlier than the rest of us, so the government doesn't have to pay out the pension monies. That's where the government's saving its money. Be cynical.
There you go. Body of evidence. The key biomarkers for heart disease from a small establishment in the US known as Harvard University, as you say, as well as the Lancet.
Yep. Yeah, this is interesting stuff. There's a institution in America, as you say, called Harvard, which is one of the great learning institutions in the world. And for the last 30 years, they've been doing the Women's Health Study. And they've been measuring a whole lot of different health parameters in women. And there's something that doctors have only recently shown any interest in. It's called lipoprotein little a. So lipoprotein, lowercase a in brackets. And as I said, doctors have only been measuring it for 2 or 3 years. Be cynical. Why? Because the pharmaceutical industry is now developing 5 different drugs that lower lipoprotein little a. Now, let me tell you something, Homer. 20% of the population have an elevated lipoprotein little a, and if they do, they're at a 70% higher risk for vascular disease over their lifetime. I've been measuring lipoprotein little a in my patients for 30 years, and I've been managing it for 30 years. But there haven't been any strong pharmaceutical drugs to lower it, but I've been using a combination of vitamin C, vitamin E, and lysine, and an old-style cholesterol-lowering drug called nicotinic acid that reduces LP little a by about 30%. That's the topic for another time. But this particular study showed that if the women in their study had a high lipoprotein little a high LDL cholesterol, and a highly sensitive C-reactive protein, which is an inflammatory marker, they had marked increased risk for vascular disease. So they're basically saying we should be doing these biomarkers in all people, including, of course, women and men, because they're at strong risk for heart disease. So, for example, we've spoken a fair bit on this podcast about the importance of coronary calcium scoring. The worst coronary calcium score I have is in a 68-year-old man in the fitness industry, like you, doesn't have an ounce of body fat, absolute rabid exerciser, and this man has a normal cholesterol, blood pressure, never smoked, not diabetic, and no family history of heart disease. So has none of the 5 major risk factors for heart disease. I don't believe they are, but none of the 5 standard risk factors for heart disease. But he has an elevated lipoprotein little a. Now, anything over 400 is a serious calcium score. His coronary calcium score is the world champion as far as I'm concerned. 8,500 coronary calcium score at the age of 68. He had bypass surgery 10 years ago, sent me an email a few years ago with a picture of him and his mates winning their latest basketball grand final.
So you wouldn't give him another calcium score test?
No, it's a waste of time. Once you get over 400, it's a waste of time having another calcium score.
But the honourable member, no, that's more a rarity than for someone in the fitness industry to have. And he looks after himself?
Not in the slightest.
To have it at that level?
No. Oh, that level's the world champion.
Yeah.
But interestingly, people who are high-level exercisers, not people who do the Walker-suggested dose, which is 3 to 5 hours a week, people who go beyond 7 hours a week have much higher rates of coronary calcification than people who are moderate exercisers.
Yeah,
so,
and that's a subject for another podcast too, especially the events arterial fibrillation, atrial fibrillation. That's happening more and more to masters athletes and all that. Yeah.
So anyhow, the point I want to make from this study from New England Journal of Medicine and from the Lancet is the importance of lipoprotein little a, the importance of having hsCRP, the inflammatory markers, and the lesser importance, I believe, of LDL cholesterol, because LDL cholesterol is not the problem. It's whether it's small or large, which I think was our first podcast. We spoke about that.
Yeah. And again, controversy, we're getting back to anti-vaxxers and the dark tetrad.
The dark tetrad, yes. This is an interesting this is more people who believe in conspiracy theories. And so there are people who genuinely believe that JFK was killed by the CIA and that Princess Diana was killed by the royal family, the moon landing was a fabrication. And a lot of these people believe that the governments have brought in COVID and they've tried to control us all and people are going to have these 5G network injected into their arm. And it's obviously complete nonsense. But they did a study on people who they filled in these surveys, and the people who scored high on believing in conspiracy theories also scored high on the dark tetrad. So what is the dark tetrad? So I'm not suggesting that if you believe in conspiracy theories, you definitely have any of these. They're just saying there was higher scores of these. So number one is Machiavellianism, which is basically being cunning. So these people who are cunning, movers and shakers who will just play people off against each other.
Shifty.
Number one. Shifty.
Yeah.
Number two, they scored high in the psychopathic scale. So really quite interesting that they were manipulative, and they had no real concern for other people. Number three, going with that, scored high in the narcissistic scale. And number four, they scored high in the sadistic scale, so like to see other people suffering. So it's interesting. I just put the question to everyone listening. If you know anyone who genuinely believes in a lot of these ridiculous conspiracy theories, ask yourself, do they also have any of the dark tetrad?
Yeah.
So it's just an interesting question. Now, I'm not saying if you don't believe in conspiracy theories, you couldn't score high in the dark tetrad either. I'm just saying it's just there's more of a tendency to have those features.
But you could understand a large segment of the population being a little bit cynical about the relationship with vaccinations and the pharma industry and everything. And I think we've got to delineate between anti-vaxxers and anti-experimental, potentially harmful vaccinations.
No,
so I'm
but
not an anti-vaxxer. I believe that, but I want to know that what's going into the body.
We were confronted with a situation with the China virus.
Yeah.
That in 2020, people were dying.
Yeah.
Quite commonly, people were on ventilators. People were getting severe long COVID as a consequence of the initial strain of COVID. The governments in the pharmaceutical world and the medical profession had to come up with an urgent solution. It's not, and the point is, with the marked improvement in technologies over the years, they borrowed from stuff that was already being developed. It wasn't as if this RNA technology was new, or the AstraZeneca viral vector technology was new, or the protein-based technology with Novavax was new. It just hadn't been used widespread in populations. So they were given the job, the pharmaceutical industry was given the job by governments, by the medical profession, to fast track all of these things. And of course, no one could suggest they were harmless, but they were less harmful than COVID. And that's the point I'm making.
Okay, I agree 100%. Okay. So Ross,
Homer, the books just fell on my head. I only have my shelf to blame.
No, it didn't, because look, circumstantial evidence, if you turn around, your shelf is intact behind you. So
I was only joking.
Are you telling fibs?
Yeah, I was telling fibs about it. But look, I just saw this man slumped over a lawnmower, crying his eyes out. And I said, mate, are you all right? He says, yeah, I'm just going through a rough patch.
And that's a great segue into this week's podcast topic of fatigue.
Yep.
What causes it and what should be done? So a quick intro. The definition of fatigue is extreme tiredness. Severe fatigue makes it difficult for you to get up in the morning and make it through your day. Many conditions and lifestyle factors can cause fatigue. You may be able to relieve it by changing your habits. If an underlying condition causes it, a healthcare provider can usually help you manage it. So everyone feels tired from time to time, but fatigue means feeling severely overtired. Extreme fatigue makes it hard to get up in the morning, go to work, do your usual activities, and make it through your day. Fatigue feels like you have an overwhelming urge to sleep, but you may not feel refreshed after you rest or sleep. So fatigue, as you know, Ross, often occurs with other symptoms such as depression, trouble concentrating or focusing, very low energy motivation, nervousness, anxiety, irritability, muscle pain, weakness. Other symptoms include tired eyes, tired legs, whole body tiredness, stiff shoulders, boredom, and impatience.
Oh.
So, Ross, you're impatient with me, but you're just genetically impatient with me.
I'm just genetically impatient. I just want to get to the damn point.
So, Ross, over to you.
Yeah, over to me. Let me say, firstly, that we all get tired, as you say. Everyone gets tired, and there are times where you just think, I just need to go and have a lie down, and that's fine. And often people come to me and say, doctor, I'm tired all the time. What sort of tonic can I take to overcome my tiredness? And that is the worst question. The question is always, what is the cause of your tiredness? Find out the cause, treat the cause, then the tiredness will go away. So there are 5 categories of fatigue I want to talk about, then finish up with a discussion of chronic fatigue syndrome, what that is. But let's firstly go through the 5 categories of fatigue. Probably the commonest cause of fatigue is you're working too hard, you're playing too hard, you're not sleeping well enough. And we've all had that, where we just had a long day. At the end of the day, we've had all of our energy drained and we're tired. And that really you just need to manage that better.
So is it a question of managing energy there?
Yeah. And I think we're given about 8 hours of active energy, 8 hours of relaxation energy, and we need 8 hours of sleep on average. I mean, it doesn't have to be exactly 8 hours. And I have people come and say to me, Doc, I haven't had a holiday for 10 years. I go, well, you're an idiot. You know, people that aren't managing their time well, people that don't take time off, just time off during the day, time off on the weekends, time off during the year, and people who work themselves into the ground, It's a recipe for disaster. So, number one, certain stressors in the body can bring out fatigue. That's number one. Number two, you've already mentioned it. There is a medical condition, not a psychologic condition, called endogenous depression. Now, endogenous depression is not to do with your life. It's to do with your brain chemicals. Now, certain aspects of living can reduce your brain chemicals. So bereavement, divorce, or moving to another area, they're 3 major life stresses, and they may change your brain chemicals. But for example, in my area in cardiology, people who go through coronary bypass grafting, 40% of people get some degree of endogenous depression where their serotonin levels in the brain drop after the bypass. I've had people come and see me and say, oh, Doc, what did you put me through this thing for? My life's worse. And I go, aha, they've got the endogenous depression. That's where antidepressants work, because it lifts back up their brain chemicals. Whereas if you go to the doctor and you say, oh, doctor, I can't stand my partner, my kids are on drugs and I hate my job and I'm depressed. No, that's grief.
But isn't it the chicken or the egg here?
No.
Aren't they depressed because they're not managing their energy? Normally, low energy, you feel, down. High energy.
That's far too simplistic.
Okay.
This whole thing's a complex interaction of your brain chemicals, how you're managing your life. And often when your brain chemicals are down, you don't manage your life so well. So the 3 cardinal symptoms of endogenous depression are, number 1, fatigue. Number 2, you've lost your interest in things. So things that you used to look forward to, you think, oh, who cares? And number 3, and this is another cardinal symptom, you wake at about 2 o'clock in the morning staring at the ceiling for an hour. You may not be depressed or not be worried about anything, but you just stare at it and you just can't get back to sleep. So early morning awakening with the inability to get back to sleep is another feature of endogenous depression. You don't need to have the full hand, but they're the typical symptoms. Now, that's mild endogenous depression. Once you get down to psychotic depression, that's where you have a total sense of hopelessness in your life and also possibly suicidal ideation. So when you hear the horrible, horrible stories where people come home with a shotgun, kill their family and turn it on themselves, that's not because their life's gone bad. It's because their brain chemicals have just hit dirt. And they just think, look, life is so bad for me, it must be bad for the people I love. I'll put them out of their misery, then I'll put me out of my misery. That's why that happens. It's a horrible, horrible situation. And please, if anyone is listening to this, please seek medical help as soon as you start to feel these symptoms, because that's where things like antidepressants do work. And there's now all of this new work on psilocybin, which is the active ingredient of magic mushrooms. There's a thing called direct cranial stimulation, which a little pad over the skull sends electromagnetic waves into the brain, and that can help as well. And that's when you hear about that stuff, that ECT, which was commonly used many years ago. It's still used, but where they shock the brain under an anaesthetic, and that can also give people relief from severe psychotic endogenous depression. So that's number 2. Number 3 is probably as common as number 1, maybe even more common, as a cause of fatigue, which is sleep apnea. So sleep apnea, in my view, occurs in all males and all postmenopausal females. And it can occur at any age in any person anyhow. So, and what sleep apnea is where typically there's two types. There's obstructive sleep apnea where the airway closes off at night, and then there's central sleep apnea where the brainstem at the back of the brain isn't working properly. And so what happens is these people, they start off awake and they drift into a deep sleep. When they get into a deep sleep, especially with obstructive sleep apnea, the airway closes over, so the body's got a choice. Stay in deep sleep with a closed airway, which means no oxygen, that's called death, or go to a lighter phase of sleep, and so you never get proper deep sleep. Now, what rejuvenates us the next day is bursts of deep sleep throughout the night. So we have 5 cycles of sleep, and we need that deep sleep going for 10, 15, 20 minutes within each of those cycles.
Heavy snorers normally sleep apnea.
Oh, yeah, they're typically more commonly sleep apneas, but you might be a light snorer or a non-snorer and have more central sleep apnea. So the key question I ask my patients about this is when you wake up in the morning after what you perceive to be a reasonable night's sleep, do you feel refreshed or unrefreshed? And if the answer is unrefreshed, you typically have bad sleep apnea. Other symptoms of sleep apnea is during the day you'll sit down to watch your favourite TV show or to just have a bit of a rest, and boom, within 5 seconds you're asleep. The micro sleeps, which are so dangerous when people are driving. So if anyone gets really tired when they're driving, please pull over and have a rest, because you could kill other people as well as yourself. And they're the sore throat, waking with a sore throat. Often, in my specialty in cardiology, it's people who wake in the middle of the night with their heart jumping out of their chest or wake up short of breath. That's often sleep apnea, because in sleep apnea, it's like someone's got their hands around your throat. So that's sleep apnea. Category number 4 is what I call the pauses. So whether it's menopause, which is obviously when women get ovarian failure, or andropause, when we get testicular failure, our testosterone levels drop, and basically all the symptoms of menopause are the same as the symptoms of andropause, except for we don't lose our periods because we never had them in the first place. But we get grumpy, psychological changes, we get night sweats, and women get exactly the same things, of course, and a lot of other things go with that. So marked fatigue occurs in your 50s around the time of those hormonal changes, which your body often adjusts to. And there are many people in medicine, I'm one of them, who do believe in hormone replacement therapy for men and women. I prefer more the bioidentical hormones than the standard pharmaceutical therapies. But again, I'm not an expert in the area, and it's best to, if anyone's listening to this and says, oh, that could be me, be guided by the experts. Go and see an expert, get an opinion, but always get a few opinions if you're not happy with the first one you get. Okay, number 5, and this is vital, is a medical condition. So you may have an underactive thyroid or an overactive thyroid. Thyroid is a great mimicker of many conditions. You could be iron deficient or iron excess. So there's a condition called hemochromatosis where you absorb too much iron into the body. And one of the symptoms of that is marked fatigue. Any autoimmune disease like rheumatoid arthritis, lupus, when you have an exacerbation, that can make you incredibly tired. Some problem in your the full blood count. You might have some early changes in the full blood count to indicate a bone marrow disorder. Fatigue's a major symptom there. Kidney failure, liver problems, heart. Interestingly, almost everyone who is headed towards a heart attack in the few days beforehand gets marked fatigue. So you can see why I'm saying to you, I don't want people to just go off and get a tonic across the counter at their local pharmacy. Go and get your fatigue sorted out, especially if it seems out of the ordinary. I mean, if you had a big night or you've worked 12-hour days for a few days and you're feeling tired, that's normal. But if you're out of the ordinary tiredness, please go and see your doctor and get it sorted out to make sure what category you're in.
So that's really intriguing. What is it as a precursor to a heart attack that's happening to maybe your blood profile that's causing fatigue? Is it decreased
easy.
Oxygen levels? Or
No. It's got nothing to do with oxygen levels. It's to do with when you rupture a plaque, so what happens in a heart attack? Imagine a donut like that with the blood going through the middle, the fat sitting there in the wall.
Yeah.
When you have a heart attack, it doesn't block the artery. It goes and cracks open like that, and then a big clot forms. So when you rupture the plaque, you're releasing chemicals into the system that just exacerbate fatigue. So those chemicals are there attracting what we call platelets to form that clot. But the chemicals go systemically around and just completely wash you out. And that process of the plaque rupturing can occur over a few days, or it can occur over 10 minutes, where somebody just suddenly has some symptoms. But I've got to say, a study done on 25 squash players who dropped dead playing squash, 24 out of 25 in the week before their death had told a doctor or a relative that they had chest pain. So you always get a warning for your heart attack, but one of the warnings may be marked fatigue. I was playing soccer 16 years ago when my knee finally collapsed, but a month before the knee finally caved in, 20 minutes into the game, the opposition left fullback drops dead in front of me. Now, because he was a fullback, I resuscitated. If he was a forward, I would have let him die. Those prima donnas don't deserve to exist. So I kept this guy alive for 15 minutes until the ambulance got there, and we hit him with a pack-a-whacker, got him back into a good rhythm, got him to Sydney's Royal North Shore Hospital, and within 2 hours had his chest split open, had bypass surgery. He's now still, 16 years later, still one of my faithful patients and doing very well. But I said to him, did you get any warning before this? And he said to me, the only thing, I was completely washed out. So he shouldn't have been playing soccer, but probably lucky he did, because he dropped it in front of somebody and knew what to do.
So things like aspirin or fish oil, omega-3s, when you're feeling like that, would that maybe avoid a heart? No?
Look, it's okay to take an aspirin.
Yeah.
Fish oil's not strong enough in that situation.
Yeah.
Fish oil's a preventative that you take for a long period of time. But aspirin, sure, might help minimise the severity of the heart attack. There's no studies have done about a 25% reduction in cardiovascular disease in people who are at high risk for heart disease who take an aspirin. But other studies, 3 major studies that have been out in the last 10 years, showed that for people over the age of 70, there's no value taking an aspirin as a preventative. So just across the board. But I still use aspirin for people who are at very high risk for heart disease, or they've got a high calcium score. And there's some work to show that people who take a baby aspirin every day have lower rates of bowel cancer. Anyhow, that's another topic. But so that's number 5 in the category. Now, the final thing we need to talk about is chronic fatigue syndrome. So what is chronic fatigue syndrome? Chronic fatigue syndrome is defined as fatigue that is present with no good cause for more than 3 months. And typically about 10, and this is the Walker theory, so not absolutely validated by science as yet, but I still think it's a good theory. 10% of people are born with slightly dodgy mitochondria. Now, what are the mitochondria? They're the fuel packs in our cells that drive the cell. Yeah. So it doesn't matter what sort of car you drive, Homer. If there's no energy in the car, it doesn't move. And it's the same thing with our cells. If our mitochondria don't work well, then the cell doesn't work well. So people who are born with defective mitochondria, they're the people that really weren't attracted to sport, don't like exercise, always the ones at school, came last in the cross country, those sort of people. So
this is just your theory, isn't it?
This is theory. Okay.
But how can you the medical fraternity come up with a syndrome when they don't know what the cause of it is?
Oh, no. But we have analysed the mitochondrial function in people, and it's on a bell-shaped curve. So someone like Usain Bolt, it just has these finely tuned mitochondria that just drives his muscles that work better than other people. And other people who are down the other end of the bell-shaped curve, their mitochondria just don't work well as the next guy. And so they chug along in life okay, and then in their 20s get Epstein-Barr virus or cytomegalovirus or some other sort of virus, and it just pulverizes what's left of their mitochondrial function. They just can't get out of bed. So I have a regime or regimen that I use for people with mitochondrial dysfunction. And so here's the interesting thing. If you're insulin resistant, you've got abdominal obesity, etc., one of the best things for you is fasting, time-restricted eating, etc., etc. The worst thing for someone with mitochondrial dysfunction is to fast.
Yes.
because they're just not getting any fuel into those mitochondria. So I say to them, have high quality complex carbohydrates 3 or 4 times a day, low doses because you don't want to get fat, but 3 or 4 times a day. So constantly have fuel going to the system throughout the day to feed the mitochondria. Really important thing to do. So you don't fast, you have regular good quality meals throughout the day, and things like ubiquinol, 150 milligrams daily, and magnesium orotate aspartate, a combination of that twice a day, feeds into the mitochondria, gives you healthier mitochondria. So there's a lot of work being done in the mitochondrial space at the moment to help those people. And I believe long COVID, chronic fatigue syndrome, fibromyalgia is all part of the same spectrum, causing this mitochondrial dysfunction that needs to be improved with what I've said. But I wouldn't want anyone listening to this to go straight to the ubiquinol and the magnesium orotate and say, oh, that's my solution. Because you've got to get it all sorted out.
It's a real conundrum, isn't it, that whole fatigue? And I'm looking at it from an exercise physiology perspective, like people that say that I haven't got enough, I'm too tired to exercise. The reality is you need to expend energy to create it.
You do, and you need, but people in that situation, they are too tired to exercise, so they've got to ease into an exercise program, slowly build up. And let me say to you, one of the best things for this entire syndrome, if you have chronic fatigue or long COVID or whatever, is cold water swimming.
Yes.
So if the temperature is below 20 degrees, it markedly improves your immune system, your mitochondrial function.
Yes.
So there's my hints for fatigue. There we go.
What about infrared saunas?
Yeah, that's not so good. If
like alternating ice baths. That's what they're doing now.
Yeah, that's a good thing to do as well.
Yeah. Okay. We've got questions from our listeners. We've got Jerry from Orange.
Yep.
And he's got drunk or drugged, then concussion. So it's a bit disturbing. I have 2 friends of a similar age who experienced the same accidents with vastly different outcomes. Both men had consumed far too much alcohol, were drunk, and whilst walking up the stairs at their home, stumbled up the stairs and hit their head into the edge of the step. Yep. Both had immediate treatment for bleeding to the head by their partner and or neighbour. One was taken to casualty and survived, albeit with serious complications from the subsequent head trauma. The other refused to go to hospital, was thankful to the neighbour for cleaning him up, and chose to sleep off his condition.
Yep.
That person was found deceased, unfortunately, by his son on Father's Day.
Oh, gee.
My question is, for someone who is more drugged than drunk, is the same danger? These men were in their 60s, old enough to know better. Is there an age group that is more prone to death from head trauma, or should all accidents involving head trauma be taken to hospital?
I think they should, especially if there's any loss of consciousness there, because you may remember that the wonderful actor Liam Neeson, his wife Natasha Richardson, was on the ski slopes, fell over, hit her head, had a bit of a headache, but just kept skiing and died about, I think it was 7 or 8 hours later, because she'd ruptured her middle meningeal artery, which is a really serious problem that needs urgent neurosurgical assessment and therapy.
Oh,
so I think any time you have a significant head injury, that especially if it's associated with loss of consciousness, I think it's important to go to a hospital. If the worst thing you have is a brain scan, so what? But you don't want to miss something like that. And that's probably what happened to the second case that you mentioned. And this is the problem with consuming too much alcohol. If you've consumed alcohol to the point where you're going to fall over and crack your skull, then there's a real issue there. So it's a serious issue, and it does need to have medical assessment. And I don't want to be flippant about this, but I knew this fellow who lived 5 minutes away from the hotel. So it'd take him 5 minutes to get to the hotel and 35 minutes to get back home. The difference was staggering.
Okay, that was a bit like black hip almost here, Ross. Okay, we got Matilda from Ballarat. I recently underwent an angiogram on advice from my doctor because I felt exhausted after walking up a steep hill.
Yep.
I stopped once or twice to regain my breath. I'm not overweight, a non-smoker, and eat a very healthy diet. My father died from a heart attack at the age of 62. I found the procedure to be very uncomfortable. They couldn't insert the apparatus into my wrist after multiple attempts and then gained access through my groin. Sounds painful. It was thankfully all clear. Is there another alternative procedure that provides the same information?
Yeah, the answer is a definite yes. I mean, the way I, as a cardiologist, how I would have, after Matilda's case, I wouldn't have sent her straight for an angiogram. I think that's outrageous. I would have first done a stress echocardiogram on her. If the stress echocardiogram was completely normal, then I would have checked her for other things like an iron deficiency, a thyroid problem, full blood count, etc., all the things I was talking about before as far as the fatigue went. And then if that was all normal, I just would have seen what happened with it. I wouldn't go straight to an angiogram. If the results of the stress echo were equivocal, so she had a few symptoms, there was some minor changes on the stress echo, I would have gone to an intravenous angiogram called a CTCA on a CT scan rather than go through the groin or the wrist. That's an invasive procedure, and it's one I do if I've got very strong evidence. So I'll give you an example. I saw a woman the other day who was 73, and she had 2 episodes of quite severe right-sided chest pain, which is not the typical place you get cardiac pain. I did a stress echo on her, and there were moderate changes on the stress echo, and I thought there's a potential she could have some significant blockages here. So I'm sending her for an angiogram based on the stress echo, because I said, look, we could do a CTCA, but if you've got a blockage in your artery, because it looks like you do, then they've got to do another angiogram. So that's 2 lots of dye, and then you can have a reaction to the dye. It can damage your kidneys. You have 2 lots. It makes it even worse. So I'm going straight to an angiogram in her case. But it's not. If Matilda says that all she had was the symptoms and straight to an angiogram, I think that's wrong.
Okay. Larry from Glen Iris. I play golf with a group of guys that are older than me. They all complain of sore joints and tweaks in their backs, but I don't notice too many of them warm up or warm down with stretching prior to or after the game. Is there an age when this is not important anymore? I mean, basically, is it important to stretch? When I did my phys ed course, even back then they said there wasn't really any compelling evidence to say that stretching avoids injuries.
No, but also the question I'd put to Larry, ask these gentlemen, are they taking statins to lower their cholesterol? Because every man and his dog is on a statin, which gives you the aches and pains in the joints and in your muscles.
Okay.
So it could be that they're taking statins. And interestingly, I've got a mate who I've known for years and years and years, and his cholesterol's always been high, and his GP's always wanted to throw a statin at him, but I've measured his coronary calcium score over the years, and it's always been 0. He's in his 70s now, and his calcium score's gone up to about 8, so certainly doesn't need a statin. And he said to me, Ross, I'm the only guy at the golf club that can still whack a ball 250, 300 metres. The rest of them are all on statins. They're all like this because they've got no muscles left.
Yes.
So, and I'm not saying statins does that to everyone, but all I'm saying is, in Larry's mate's case, again, find out the cause for why the joints are sore. And I don't think it's just that they're not stretching.
See, I really admire, I don't want to piss in your pocket, then I can't.
No, you can urinate in my pocket. Like that.
But you are what I think all doctors should be, lifestyle practitioners instead of pharmaceutical dispensers.
Yeah, well, look, I talk about the 80-10-10 rule all the time.
Yeah.
80% is how you look after yourself, 4 times more powerful than anything a damn doctor can suggest.
Yeah.
10% is the appropriate use of medical therapies, pharmaceutical treatments, procedures, etc. 10% is the appropriate use of evidence-based supplements. But really, it's the lifestyle that's key.
Yeah, I think we've got 2 more quick questions. Donna from Sorrento. Is there a simple blood test to see what sort of arthritis I had? I'm a 63-year-old fit, exercise, do weight 3 times a week regularly, but my bones and joints are becoming sore.
Yeah. Well, it's not just arthritis. It might also be osteoporosis. So I think in Donna's case, she needs a DEXA scan to measure how much osteoporosis she has, and then just a general blood screen. There are simple blood tests where we just do a normal full blood count, a thing called ESR and HSCRP are inflammatory markers. And there's all of these tests for the autoimmune arthritis, rheumatoid factor, SLE test, so it's anti-nuclear antibodies. You're going to have a workup for a whole lot of the less common causes of inflammatory arthritis. But the interesting thing is, does someone have an inflammatory arthritis caused by one of these autoimmune disease, or is it just more osteoarthritis causing their aches and pains? And the simple blood test will do that very simply. And if people are getting still ongoing problems and their GPs aren't helping them, a referral to a rheumatologist to have it sorted out properly is probably the best way as a one-off thing to do.
Okay, and last one is Samantha from Brisbane. Dr. Walker, can you explain a bit about vertigo? I developed a bad case in 2011 and I've been to vertigo clinics to help me out, but I've never been the same in my headspace.
Yep.
One doctor said it was virus related. Another said it was when the crystals move in your ear. I take ginger tablets for the nausea symptoms. They've helped a bit. What do you think caused it, and how can I prevent an episode coming on?
Well, very good question, and different answer to probably what Samantha wants to hear. But not all people have vertigo. They think they do, but they don't. There are 3 types of dizziness. I saw a woman the other day who said, "Oh, doctor, I've had vertigo." She described it to me. I said, "That's not vertigo." So vertigo is when you're looking at me and I'm going. So if people don't have that rhythmic movement when you're looking at them, it's not vertigo. If it is vertigo, the doctors are right. It's due typically post-viral due to problems. The post-viral syndrome affects the crystals in the inner ear, and so therefore you get a sense of rotatory movement of the environment, okay? If that's vertigo, then you can be given a set of exercises for your neck that does help to some extent, but then it's just a matter of symptomatic treatment. With ginger may help to some extent. There's during an acute episode, good old-fashioned Valium helps, not because it calms down your anxiety, it just works on the inner ear, as does Phenergan, which is an over-the-counter antihistamine, 25 milligrams half at night. That helps as well. But then the other 2 types of dizziness, so number 2, what we call pre-syncope. Now, pre-syncope is when you stand up quickly and you think, oh, gee, I could collapse here. People say, I've had a vertigo. I've said, no, you haven't. You've had pre-syncope, where the blood's not getting up to the engine room and you feel a little bit lightheaded, like you could go down. And that's typically due to some sort of cardiac problem where you're just not pumping blood up to the head. And then the final one, probably the commonest cause of dizziness that people wrongly label as vertigo, is a thing called disequilibrium, where you're feeling wonky. And you feel, oh, I'm a bit unsteady on my feet, not the environment's unsteady. And that's typically due to a neck problem. So, yes. And I don't know anyone over the age of 60. Here is a bit of a detailed medical term, Homer. I don't know anyone over the age of 60 who doesn't have a crappy neck or a crappy back. We all do. It just comes from going well beyond our use-by date, which is 40. So you get your crappy neck and you've got these blood vessels that go up the back of the neck and they get affected by the blood flow going up there. And so it can affect just the way you monitor things when you're walking, and so you feel wonky. So it's a neck, it's an eye, it's a joint problem.
So you're not into osteopaths or chiropractors?
No, that's not right. I think osteopaths are very good. I personally have a thing about chiropractic manipulation. I've had a manipulation of my lower spine without actually. I thought it was an osteopath. I was told this guy was an osteopath and he was a chiropractor. I found it quite uncomfortable. I prefer osteopathic mobilization rather than manipulation. But look, there'll be chiropractors that say, oh, that guy doesn't know what he's talking about. Chiropractic manipulation is terrific. And there'll be many people who've been helped by chiropractors. So I don't want to get into that discussion because I respect what all health professionals do. I'm just saying I don't like any manipulation of the neck, but chiropractors don't do that these days anyhow. I've seen people have strokes after neck manipulation. So you mobilise the neck, not manipulate.
Okay. I think that's about our episode for this week. So we could sign off here. See you next week, listeners. Thanks for listening. If you want more information on what we do, go to seriouslyfunnywellbeing.com and you'll get everything there. Bye from me.
Bye.
Bye.
Hello, listeners in Australia. I've got a big secret to let out about my good friend, Homer Papantonio, the corporate imposter. He's the best speaker I've ever heard. I only deal with the best. He's a great athlete, great cyclist too. And the real reason he's the best is that he uses the best omega-3 supplements on the planet, produced by ZinZino. Homer needs to perform at his absolute best on and off the stage. That's why he takes the best omega-3 supplement on the planet.
Well, yeah, I know about Homer taking ZinZino Omega-3. I've been using it too. It's derived from highest quality ingredients from all natural sources. These Omega-3 balanced oils are molecularly tested for toxins to ensure only the purest and freshest ingredients are used. You can even have a blood test to see what your Omega-3 status is.
Oh yeah, this Omega-3 from ZinZino is the single most scientifically supported supplement on the planet. And the health outcomes are big, really, really big. It's an absolute no-brainer for every man, woman, and child. It's the best, the biggest, and the best. And you can buy it at ZinZino.com. ZinZino.com.
Like Homer, I've been sucking on ZinZino Omega-3 capsules and solutions for the past year. It helps reduce Alzheimer's and dementia risk, inflammation, mood, improve sleep and immunity, and the list goes on and on and on and on, like you do.
Don't worry about it. Well, ZinZino Omega-3 is the best. I only deal with the best. Go to ZinZino.com. That's ZinZino.com. Simply the best.